Welcome back to the lecture series on periodontics. In this video, we are discussing about gingiva. Now let us start with a basic question. What do you mean by periodontium? Periodontium is referring to the supporting structures of the teeth. So periodontium has four principal components: gingiva, periodontal ligament, cementum, and the alveolar bone. So these components are working together to support the teeth and keep them functional. So without this support, tooth will not be able to withstand the forces of chewing or any other stresses in the oral cavity. Now let's move on to the concept of periodontal phenotype. To understand this, we first need to know what is a phenotype. The word phenotype refers to appearance and behavior of the tissue. So what is a periodontal phenotype? It is a combination of gingival phenotype and bone morphotype. Gingival phenotype refers to the three-dimensional gingival volume and the width of keratinized tissue. Bone morphotype refers to the underlying bone structure. So periodontal phenotype is a term introduced in 2017 classification system. So let us see what are the types of periodontal phenotype. So this periodontal phenotype is classified into three types: thin scalloped. So here the gingiva is thin and it is scalloped. Second is thick scalloped, thick and scalloped. So in thick scalloped, gingiva is thick and gingiva is showing the scalloping. And third is thick flat. Here gingiva is thick but scalloping is minimal, it is flat. Next, let us understand the difference between a biotype and a phenotype. So biotype is referring to the fixed genetic characteristics, whereas phenotype on the other hand, it can change over the time. It is not fixed. It can change over the time. So this change can be because of environmental factors or because of some modification therapies. So periodontal phenotype plays an important role in the disease progression, and it also impacts the bone resorption. Next, let us briefly discuss the zones of oral mucosa. Oral mucosa is divided into three zones: masticatory mucosa, lining mucosa, and specialized mucosa. Masticatory mucosa is involving the gingiva and hard palate, whereas lining mucosa is covering the areas like cheeks, lips, alveolar mucosa, and floor of the mouth. So masticatory mucosa is keratinized, lining mucosa is non-keratinized, and it is more flexible. Third one is the specialized mucosa, which is usually found on the dorsum of the tongue. Gingiva is a part of the masticatory mucosa. Next, let us understand about the anatomy of the gingiva. Next, let us discuss about the anatomy of the gingiva. So gingiva is divided into three components: marginal gingiva, attached gingiva, and interdental gingiva. So let us take a closer look at each of these. First, let us start with the marginal gingiva. So marginal gingiva is also known as free gingiva. This is the marginal gingiva, which is also known as free gingiva. And this marginal gingiva is forming a collar around the teeth. So it is separated from the attached gingiva by a shallow depression, which is known as free gingival groove. So this is the marginal gingiva and it is separated from the attached gingiva by a shallow depression. So this is the marginal gingiva and this portion is the attached gingiva. So marginal gingiva is separated from attached gingiva by a shallow depression, which is called as free gingival groove. So now let us talk about the width of marginal gingiva. Marginal gingiva is approximately 1 mm thickness or 1 mm wide. So here the term wide means it is talking about the horizontal dimension or the thickness of marginal gingiva. So marginal gingiva is 1 mm wide. It is forming the soft tissue wall of the gingival sulcus. So this is a gingival sulcus. So marginal gingiva is forming the soft tissue wall of the gingival sulcus. So this portion of the marginal gingiva is forming the soft tissue wall of the gingival sulcus. The most apical part of the marginal gingiva is known as the gingival zenith. So marginal gingiva, apical most portion of the marginal gingiva is known as gingival zenith. Gingival zenith need not to be in the center of the tooth. It can be anywhere. Let us understand the measurements of gingival zenith. Gingival zenith can be measured in two ways. Apicocoronal measurements, that is vertical dimension, and mesiodistal dimension. Apicocoronal dimension measures the vertical position of the gingival zenith relative to the gingival margin. So this is the gingival zenith, and this is the gingival margin. So to measure this, you have to imagine a vertical line passing through the tooth long axis and note the gingival zenith position. So by drawing a vertical line passing through the long axis of the tooth, so the center of the gingival margin is located. So from this center, you have to note the gingival zenith position. So whether the gingival zenith is above this line or below this line. Next is mesiodistal dimension. So mesiodistal dimension measures the horizontal position of the gingival zenith. Now it tells whether the gingival zenith is closer to mesial, distal or center of the teeth. So here the center of the teeth is taken as the reference. So from the center of the teeth, where is the location of the gingival zenith in the horizontal position? So is it mesial or is it distal or it is at the center of the teeth? So this is how mesiodistal dimension of the gingival zenith is measured. The dimensions of gingival zenith can range between 0.06 mm and 0.96 mm vertically and horizontally. Now let's move to the gingival sulcus. Gingival sulcus is a V-shaped crevice or a space around the tooth. So this is the gingival sulcus, which is having V shape. Now let us see the boundaries of gingival sulcus. Gingival sulcus is bounded by the tooth surface on one side and the soft tissue wall of the marginal gingiva on the other side. The sulcus depth is varying depending on the conditions. So in a germ-free environment, the depth of the sulcus is 0 mm. Whereas in clinically healthy humans, if you take the histological depth, it is 1.8 mm. Probing depth of the gingival sulcus is 2 to 3 mm. Periodontal probe is used to measure this depth. Periodontal probe is used to measure this depth. Now let us connect this to the periodontal phenotype. If a periodontal probe is visible after you insert through the gingiva, if this is the case, then gingiva is classified as thin. If the periodontal probe is not visible after insertion into the gingival sulcus, then gingiva is classified as thick. So this visibility technique helps us determine gingival thickness, which is important clinical parameter. Let us understand about the attached gingiva. Attached gingiva is continuous with the marginal gingiva. Attached gingiva is continuous with the marginal gingiva. This is the marginal gingiva. Attached gingiva is continuous with the marginal gingiva and it is an essential component of the masticatory mucosa. Now let us explore its characteristics and clinical significance step by step. So let us understand about the characteristics of the attached gingiva first. Attached gingiva is firm and it is resilient. Here resilient means it can spring back to the original shape when the pressure is applied. This resiliency is because of the collagen fibers which are present in the connective tissue. Attached gingiva is tightly bound to the periosteum of the alveolar bone. What is periosteum of the alveolar bone? Attached gingiva is bound to the periosteum of the alveolar bone. So what do you mean by periosteum? Periosteum is the outer covering of the bone. So this is the alveolar bone. So outer covering of the alveolar bone is known as periosteum. So this periosteum is made up of dense fibrous connective tissue. Collagen fibers which are present in the connective tissue of the attached gingiva are tightly bound to the periosteum. This binding is helping the attached gingiva to withstand the mechanical forces during the mastication and brushing. Attached gingiva is an immovable tissue, whereas alveolar mucosa is relatively movable. Attached gingiva is immovable, offering stability to the soft tissues of the oral cavity. The line which is separating the attached gingiva and alveolar mucosa, as already mentioned, it is known as mucogingival junction. Now, let us discuss the width of the attached gingiva, which is an important clinical parameter. What is the width of the attached gingiva? It is the distance between the mucogingival junction, which is stationary throughout the life, and the projection on the external surface of the bottom of the gingival sulcus. So this is the bottom of the gingival sulcus. You can see a projection on the bottom of gingival sulcus. So from there till the mucogingival junction is the attached gingiva. Let us understand the difference between the width of the attached gingiva and width of the keratinized gingiva. Width of the attached gingiva is not including the marginal gingiva. It is from the external projection of the base of the sulcus to the mucogingival junction. That is attached gingiva. Whereas width of the keratinized gingiva is including the marginal gingiva. So from here to here is the width of the keratinized tissue. This tissue width is including the attached gingiva plus marginal gingiva. Let us see the dimensions in different areas. So the width of attached gingiva is varying across different areas of the mouth. In the maxillary incisor area, the width of the attached gingiva is 3.5 to 4.5 mm. In the mandible, it is 3.3 to 3.9 mm. That is near the mandibular incisors. So in the premolar areas, you see the narrower width of the attached gingiva. It is 1.9 mm in the maxilla, and in the mandible it is 1.8 mm. Near the first premolars. This measurement is near the first premolars. Now let us understand how the width of the attached gingiva is measured in different scenarios. In healthy periodontium, attached gingiva is measured from the base of the sulcus to the mucogingival junction. So this measurement is reflecting the true width of the attached gingiva. When you are trying to understand the width of the attached gingiva, it is important to know about the biological width. The new term for the biological width is the supracrestal attachment. The supracrestal attachment includes two components, junctional epithelium and the connective tissue attachment. The junctional epithelial component of biological width or the supracrestal attachment is attaching to the tooth, and the connective tissue is getting attached to the tooth and also to the bone. So while calculating the attached gingiva, it is important to understand the supracrestal attachment. So whereas in the periodontal disease, junctional epithelium is migrating apically and the base of the sulcus is no longer a stable reference point. So here the sulcus is including the inflamed connective tissue and also the pocket epithelium. These two are not a part of the attached gingiva. In such cases, we do not use the sulcus as the reference point. Instead of the sulcus, in order to measure the attached gingiva, we are using the crest of the alveolar bone as the stable reference point. In periodontal diseases, we are using the crest of the alveolar bone as a stable reference point. The distance from the crest of the alveolar bone to the mucogingival junction is giving the width of the attached gingiva. This is the true measurement of the attached gingiva in the deceased cases. When you calculate this, the attached gingiva can be present or it may be absent. So alveolar bone crest is a stable reference point even in the periodontal disease. So here we are taking the mucogingival junction as the second reference point. First reference point in the periodontal disease is the crest of alveolar bone, and the second reference point is the mucogingival junction. So mucogingival junction is a stable reference point throughout the life. So here we are taking the mucogingival junction as the second reference point. So one last point to note is mucogingival junction is stationary throughout the life, which makes it reliable landmark for the measurements. Width of the attached gingiva can change with the age or conditions like supraeruption. Now let's move on to the next anatomical component of gingiva, interdental gingiva. So interdental gingiva is a part of the gingiva which is occupying the gingival embrasure. Now before we understand the interdental gingiva in detail, let us first define what is gingival embrasure. So gingival embrasure is the interproximal space just located beneath the contact point of adjacent teeth. So this is the contact point. So just beneath the contact point, the space that is present is known as interproximal space. So this space is completely occupied by the interdental gingiva. So this is the contact point. Below the contact point, you see the gingival embrasure. This gingival embrasure is occupied by the interdental gingiva. So there are different forms of interdental gingiva. One is the pyramidal form and second is the caul shape. So in this pyramidal form, interdental gingiva is having a pinpointed papilla. The tip of the papillae is located immediately beneath the contact point of the adjacent teeth. So the caul shape is a valley-like depression which is found in the interdental area. So this is a molar and this is a contact point. So here you can appreciate caul shape is a valley-like depression which is found in the interdental area. So this depression is connecting the facial and the lingual papillae. If you look at the interdental gingiva from the faciolingual aspect, the caul shape is adapting to the contour of the interproximal contact. So what are the factors affecting the shape of the interdental gingiva? So the shape is depending on several factors. First is the presence or the absence of the contact point. So if the teeth are in the proper contact, you will typically see a pyramidal or a caul shape interdental gingiva. If the contact point is missing or if there is any spacing between the teeth, then interdental space is filled in a different way. So second factor is the distance between the contact point and osseous crest. So the distance between the contact point and the osseous crest. The closer the contact point is to the bone, the more pronounced interdental papilla will be present. If the distance between them is too large, then you can see the flattening of the interdental papillae, or you can see the absence of the interdental papillae. Third factor is the presence or absence of the gingival recession. In cases of recession, the shape of the interdental gingiva may be altered due to the loss of the tissue. Now let us look more closely at the structure of the interdental gingiva. So the facial and the lingual surfaces of papillae are tapering towards the interproximal contact point. The mesial and the distal surfaces are slightly concave, giving the interdental gingiva its characteristic shape. So the lateral borders and the tip of the interdental gingiva or the interdental papilla are formed by the continuation of the marginal gingiva. So this is the marginal gingiva. It is continuing as the interdental papillae. And the center portion or the intervening portion of the interdental gingiva is made up of the attached gingiva. This is providing the firmness and the stability. If suppose there is no contact point between the teeth and if there is spacing between the teeth, in such cases, interdental gingiva is firmly bound to the underlying interdental bone and it is creating a very smooth and rounded surface. In these situations, there is no interdental papillae as the tissue adapts to the absence of the contact points. By this, we have completed our discussion on the anatomy of the gingiva.